and skin cancer expert Dr. Helena Rosengren from the Skin Repair Skin Cancer Clinic is with us this morning to just remind us of why we need to be careful when we're stepping outside this summer. Dr. Helena Rosengren, good to have you on the program. How significant is this week for you?
Good morning, Michael. Yes, this is a bit of a highlight for us in terms of having an opportunity to assist the public in getting safer. So we're getting right behind this campaign and hope to be in touch with all our patients regarding safety tips.
Generally, because we live in North Queensland, we've been, we live in the heat, we live in, one of the sunniest places in Australia. Do you think we're pretty good at taking on board that SunSmart message?
Sadly, I really don't. The studies show that about 35% of ladies and maybe 21% of gentlemen are using sunscreen on a daily basis or on a regular basis. But for women, a lot of that is just a little bit of sunscreen in the makeup or once daily application in the morning. So there are not enough of us using proper sunscreen on a daily basis. The misconception is that you only need sunscreen when it's really hot. But of course, sunburn and sun damage and skin cancer has really nothing to do with heat. It has to do with the UV index. And the UV index can be excessive even when the temperatures are low. What a lot of us think is that you need to burn in order to develop skin cancer. But we now know that it's just small amounts of incremental time out in the sun, a few minutes here, a few minutes there, maybe hanging, washing, driving to work, nipping out at lunchtime to grab a paper or whatever. Just those few minutes here and there are enough to cause serious mutations in the skin over time, over weeks and months and years, that then later equate into skin cancer. So the national advice now is that we should all be using proper sunscreen every day, regardless of where we work, regardless of whether we're indoor or outdoor workers, if the UV index is predicted to be above 3 on that day.
And as we know here in North Queensland, it's always above that. It's expected to reach 12 today, which is an extreme reading. So we should be doing this all the time. Is that your message?
Every day. It should be an everyday routine for all of us, apart from very young children, babies. They're the group that we don't yet recommend sunscreen for, the under 6-month-olds. But otherwise, ideally, it should be a routine that we all get into, something we automatically reach for, perhaps as soon as we brush our teeth or something like that. And then, of course, if you are an outdoor worker or you're having a recreational weekend, then you need to reapply that sunscreen every 2 to 3 hours, especially if you're getting hot and sweaty or swimming. But for many of us who work inside, it's just that once daily application in the morning.
And is it, a big application? It's because I think a few of us just, a few, wipes here and there of the sunscreen. How do you apply it properly?
Well, you do want a reasonable amount, but we also know from the studies that people actually automatically use a lot less than what is recommended when you read the bottle. And yet that amount is sufficient to prevent sun damage and skin cancer. And that's very, very clear from multiple studies that have been done in low and high risk groups that it definitely prevents sun damage and skin cancer, even if it's not ladled on. So I think just go with your gut. Use what you think is right, plenty, and rub it in. Now, the sunscreen, if you're an indoor worker, doesn't have to be waterproof. So it could be a chemical sunscreen that is not waterproof. Therefore, it feels pleasant. It feels like a moisturizer that you're applying. So it's easy and pleasant to apply even for young children.
Mm-hmm. And for people who might be listening this morning, Doctor, and saying it makes sense if we get a bit of sunlight exposure, that we need the vitamins we get from the sun, what would you say to that?
Yeah, there's a big drive for this nationally, actually. We do know that we need a little bit of sun for vitamin D. And there will be recommendations coming out that people who are not at high risk of skin cancer should get a little bit of sun exposure for vitamin D. So now this means only a few minutes going about normal day-to-day tasks with sunscreen on. So it's not without sunscreen, is with sunscreen on. In the summer months here, say at 11 o'clock in the morning, you literally only need 3 minutes with maybe t-shirt or shorts on, hanging washing out. That is enough to get your vitamin D levels, and that's with sunscreen on. So it's minimal. There's a misconception amongst the public, and sometimes even the medical fraternity actually, that the longer that you spend outside, the higher your vitamin D levels will be. That's not true. You only need a few minutes to get adequate vitamin D levels, but it does need to be regular through the week with sunscreen on. That's the important message.
And this comes at a very important time because we've got, summer approaching. Our school leavers are getting ready to enjoy all their time off, and there'll be a lot of people sitting on the beach and sitting around pools this summer.
Sadly. Yes, you're right. And it's a difficult message to get across, isn't it? Of course, we have to enjoy the sun. We live in this beautiful sunshine state, and we have to make it work for us. But as much as possible, my advice would be, enjoy those recreational times earlier in the morning, later in the afternoon. Keep as many clothes on as you can, and your sunscreen, hats and sunnies.
Yeah, it is such an important message both for long-time locals and also people who have just come to live in North Queensland, because that message is really important for us here in the tropics. Great to talk to you again, Dr. Helena Rosengren, and really important messages to get out during this week.
Thank you for the opportunity.